Okay, guys, the correct answer for this question is option B, which says administer 0.9% normal saline. Why? Now, looking at the parameters we have on the screen, we have it that the blood glucose is 520 milligrams per dl. That is very high. And then the blood pressure is 90/58 millimeter mercury. That is hypotension. So why is the blood pressure that low? This is because the blood sugar is too high and the body cannot utilize this sugar to form energy. It breaks down fat into glucose and ketones, and these ketones could make the body to be acidic. That is why we call it diabetic ketoacidosis. Some of us will rush and choose the first option that says we should administer IV insulin, but that's wrong. Why? The blood pressure is low because the sugar is too high, and then because the kidney wants to compensate, it then asks itself, what can I do to bring down this blood sugar? And then it decides to excrete more fluid, because as it excretes the fluids, the sugar goes away with it. So if you check this patient's urine, you find that there is glucosuria. There is a high level of glucose in the urine. As the body tries to reduce the fluid volume, it's going to reduce the blood glucose. And because there is hypovolemia, it's going to affect the blood pressure. This blood pressure is going to come down. Because of the hypovolemia, this patient can go into hypovolemic shock. So our priority now is fluid resuscitation. So after you have given the patient fluids, like 0.9% normal saline, it's going to help to increase the patient's blood volume. And thereafter, the blood pressure is going to increase, and this is going to come to a normal or a more stable range. And after achieving that, you can now go ahead to control the blood sugar slowly. That's when you can now administer your insulin or any other oral hypoglycemic drugs that you have. Then the sodium bicarbonate can also come later. That is to correct the acidosis this patient is having. And then you also have Kussmaul respiration. That is a deep, rapid breathing because there is acidosis. So because there is acidosis, the lungs try to blow off excess carbon dioxide so that there won't be enough carbon dioxide that will combine with H2O in the blood to form carbonic acid. I uploaded a video on acid-base imbalance and arterial blood gas analysis on YouTube. So I'm going to drop the link in the comment section so that you can go there and look at it. So our answer for this question still remains option B, which says administer 0.9% normal saline.